right, let's redo. Okay, let's start again. Okay. Let me get this up. Hold on.
Yeah, please.
Right, okay.
Yeah, please. Yeah.
This is our second.
It won't bring our
second disaster action.
Yeah.
Okay
then. Yeah. So, my name is Zina. I'm a GP at Hiyos practice, and I'm your mental health companion on our webinar journey. And we discuss this, and it will be like live webinar every week. And today we'll speak about depression. And my guest today,
I'm a very guest. I wasn't a planned guest. I was the last option because 2 people dropped out. Just to let everyone know that this was not planned.
No. But thank you anyway for Sunday being here with us today. It's not so easy, I know. Yeah.
So I'm Saira. I'm practice manager here at Hiyos.
Yeah. So today we'll speak about depression. We said last week we spoke about stress, and we try not to stress today.
We're using these today. The amount
we are not
stress. Okay, this is coming in handy from last week.
Yeah. Anyway, we will speak about the different mental health issues as we discussed this before. So we spoke about stress, and it's important for our audience to understand this is not treatment, this is not a management or a consultation. This is just general information that can, encourage them to seek help and raise the awareness of like different mental health problems, especially in young adults.
Yep.
So today the plan was to speak about, about depression. You don't know. So I'm telling you
out now the topic of the day.
So today we'll speak about depression, just to let you know. And a lot of things happening, and a lot of people speaking about depression, and a lot of people think they have depression when they don't have it, and the other way around. So what do you think? What do you think about depression? How do you define it?
Yeah, well, you'll give the proper definition, but I'll tell you what I think it means. But I was thinking, just right now you mentioned like stress, anxiety, which we were talking about, last week we talked about stress, then you've got anxiety, then you've got depression, and it's like, what is the difference? And I don't know how you're going to do webinars on all, because I thought it kind of just, how are they different? But in my head, when I think of depression, like visually, I'm imagining someone sort of locked up in a room, in a dark room. Maybe it's raining, you're alone, and you're probably crying in a corner somewhere. So when I think of depression, that's what comes to mind.
Yeah.
That's what kind of I think of. And I remember, when I didn't know this, but when I started working here, I didn't know that SAD was an acronym for, you might have depression, right?
Yeah.
So that came to mind. I was like, oh, everyone gets sad, right? So does that mean everyone, everyone's depressed? Or everyone, I think everyone will go through some form of depression at one time or another, but I'm sure you will explain what the actual definition is.
That was amazing what you've said, really, because it's like this, as you describe it, it's one of the descriptions people can describe themselves feeling like this when they are depressed. And sadness and depression go hand in hand, so exactly as you said. And stress, anxiety, depression, all these things, is not so easy to distinguish between them. Sometimes it's like a vicious circle. You have all of these happening at the same time. So really it's not easy. It's like complex thing. But anyway, if we want just, sometimes we do things easier for us, especially doctors, just to understand what's happening. Because as you said, it's not so easy for us. Anyway, depression is like chronic, serious mood disorder, and to diagnose this, we have certain criteria, certain questionnaire, and history taken, a lot of things happening here, but definitely feeling low or down for a long time, in addition to the lack of interest and pleasure in certain things for more than 2 weeks. This is depression.
Right. Okay. Because when you were saying that, I'm sure everyone, part of their day,
we feel like this.
So this is like long period of time.
Exactly. And it's like continuous. So it's not like,
one-off. Yeah.
Exactly. Because sometimes, we have these ups and downs in our life. So it's not every time I'm down, I'm depressed. We say I'm depressed, but
Yeah. That's the term that a lot of people use, right? Oh, I feel really depressed today. And I feel like it's a normal sort of thing.
Yeah. So the thing is that I'm just maybe just a bit about the diagnosis of depression before we go in all details. It's not so easy. Sometimes you're speaking to our friends, to our family, you're depressed. It's not so easy or too easy to say you are depressed. There are like a lot of things we need to think about. There are a lot of criteria. And one of the most important things, when we meet people, like detailed history about how you feel, when do you feel it, and the circumstances around it. And if there are other factors, if you're like ill, having other issues. So a lot of things we need to think about them before telling patients you're having like depression. So I think we need to think about it and not just to say you're depressed, you need treatment or whatever. So so this is the thing. What do you think about the causes? Because if we say like if we know now it's like these two things, like feeling low and lack of interest. What do you think? What could be the?
It could be to do with family life. You've got work. Your health, like you're mentioning. It could, I think, your environment. It could be anything, really.
Yeah.
It could be, you could feel low in all sorts of areas. I feel like.
Yeah, it's like this. Really, it's like this. The problem with depression is like a real complex process affecting the chemistry, the brain chemistry, and the neurotransmitters. And the main thing going there as well. It's not the main. One of the main factors is the genetic factors. There's mental health issue or depression in the family. So this makes things like more susceptible, people more susceptible to get depression. So this is one of the things. And as you said, the social factor is important, the academic pressure, the stress of the exams, if it's like for a long time, trying to fit in socially with the friends, with these things. Social media, one of the biggest
We've got a topic, we've got a whole webinar on that one.
Yeah.
It's such a huge topic.
Yes, that's really sad. And I don't know if you've heard about this, the suicide risk increases with social media, like bullying and harmful content. So it's really, really scary. So, and in addition to the physical health, some people have like illnesses that like chronic illnesses that might cause to this. So a lot of factors, stress, anxiety, these things, as we said, if you continue having stress for a long time without any help, this might lead to depression. Sleeping, it's the same thing, vicious circle. If you're not sleeping enough for a long time, this affects depression, and the depression might affect the sleeping issue. So it's like this.
You have to really look after yourself. I think that, like with physical things, I think people do kind of act upon it, don't they? You've got a problem, you've got a cough, you've got a cold, you've got leg pain, this pain, and you actually, you would seek help. You go to the pharmacy, you go see your GP. I think when you've got like mental health, issues, I think you're less likely to sort of, go and speak to someone. Do you think, I don't know, why is this? Why do people not sort of feel comfortable maybe to talk about it?
Yeah, and this is the idea, behind our project here. We want to break the stigma, seek for help, because this is the sad thing or the good thing, we don't know. There is help all the time. So it's available, just you ask for it. Anyway, so if we go back to the diagnosis, as we said, how to know this person is having like depression or not. There are a lot of things. Let's start with the main thing here, the patient seeking help. Otherwise, we don't know if the patient is having depression or not. So the thing is that, let's say they start seeking help, met one of the GPs here. So they start, as we said, conversation. We know about everything, because depression itself, it could be depression, but it could be part of bipolar syndrome, which is like, a period when you feel depressed and another period like hyperenergetic. So this is another issue. It could be postpartum depression. People like pregnant women giving birth, and after a while they think it's like she feels low because she's tired. No, this was postpartum. Seasonal depression with, with change of the season. So like a lot of things really. And I just now came to my mind 2 or 3 cases really of young girls who been put on antidepressant, and then we discover they have very low iron level. So once we, treated the iron level, the low level with supplements, they became better. So like we really need to have a good assessment of the person before like deciding is this depression or not.
So you need to spend quite a lot of time with that person in consultation.
Sure.
A lot of the time, it can be quite it's really hard because a lot of GP appointments are like 10 minutes long.
Yeah.
This requires a bit more time. Like you said, it's not just someone comes to you, says they've got depression, you give them something and go away. It's not.
Sure
like
not.
that. You need to actually go and look at other things around what's going on in their lives.
Yeah. So it will be like we need to know everything before decide the next step. So this is the diagnosis. We speak about the diagnosis. And then we speak about the symptoms. What do you think about the symptoms?
Yeah, so I think like I was mentioning, I think feeling quite low, feeling sad. I don't know, sometimes I think you just want to be alone. Don't really want to speak to anyone. I know, I don't know, we might cover it, but, feeling suicidal. I don't know if that's feeling extreme, but does that come under it?
Yeah, this is amazing. Yeah. Because you started with the start, feeling sad, and you ended the suicide. Yeah. These are the symptoms, as we said, feeling down all the time, especially for a long period, and especially if there's no obvious factor for this. So we need to think why I'm feeling like this, and the lack of interest and energy, lack interest and pleasure in doing things that I was like enjoying previously, lack of like energy, feeling tired all the time, and this is the thing. Sometimes they are just feeling tired, and no one takes them like seriously. This could be like a sign of depression.
Yeah. And you mentioned like seasonal as well, because, winter time, it's dark really early.
Yeah.
And like you said, you might feel tired, you're not getting enough vitamin D.
Yeah.
And then, you think,
this is,
you think, is it normal? Is it not normal?
Sure. Okay. So we need to think about these things. In addition to this, we have problem with sleep. It could be like oversleeping, or it could be like lack of sleeping, appetite. Some people like gain weight because it's like, emotional eating. They're just eating to...
Me?
Yeah. You don't have the pressure.
I'm stressed out. Like eating.
This is one of the things. Or the opposite. They just stop eating. And we come to the, death thoughts and the suicide and these things. And this, as you said, extreme. And the good thing, really, we have help for all these things, even the suicide, which is the extreme part of it. So we have help. Just ask for it. This is the thing.
But I think it is difficult though, especially for young people, like where, I know we were saying, we throw around the word quite a bit, like, I feel depressed, or I'm depressed today, or this or whatever. But I think everyone always thinks, oh, that's not me in that situation.
Yeah.
I'm not that bad. Or I'm not, so I think it is hard. And I feel maybe sometimes they might feel a bit, going to my GP, what do I expect? Are they going to listen to me? Maybe they're just going to give me some medication, and then that's a whole different thing, isn't it? Going on medication and then feeling...
Sure.
Yeah, I don't know what your thoughts are. Like, is that what happens? Like when someone comes to see you for depression, do you give them like medication straight away?
Yeah.
Or how does it work?
Do you know, it says something very important now. They are not telling how they express themselves, because sometimes they have this guilt feeling. So therefore, they are not seeking help, or they don't want to, make their families or, worried. So the guilt feeling is part of the whole process as well. No, definitely not. Regarding the treatment, since we are doing so deep assessment for everyone, so definitely, for me personally, and even according to the guidelines of NICE guidelines, these things, so the medication is not the first choice. So you don't need to be worried about this. Yeah. It's not like this, because what we need to know, first of all, we need to know what level are you. And we give like something questionnaire, one of them PHQ-9, which is used to assess your depression level. Is it mild, moderate severe, or very severe? So like a lot of things. If it is like a suicide risk, definitely this will be another issue. Crisis team involved and the hospital. This is different, and it's not definitely our job in the primary care, but there is help as well. And then we assess and we see where the patient is in this level, and then it's always the patient's choice.
Yeah.
Never, there's no one force anyone to do anything. So it's like a teamwork. We are here to help, but it is the patient's decision. If the patient wants like medication or whatever, we like come in with all the options. The main option is the psychotherapy or talking therapy or talk therapy, and it will be like either psychotherapist or counseling. This is very important because they will, equip the patient with the tools needed to control these things. This is one of the things. before that, we need to dig deep to see what's the factor here.
Yeah.
What's the problem here? So this is one of the main things as well. Relaxation, as we said, we discussed this maybe previously in general, meditation, all these things, mindfulness is important. Physical activity is really, really important, For my experience, not for depression, for other issues, stress, for example, boxing was working amazing. So I recommend boxing. You don't need, to be athlete or elite level, but boxing is really important. And you can choose whatever, maybe jogging, any other things. And then social support is important. If we feel like there is a need for social support, definitely. There is a communication between the GP practices, schools, and even the families if we need. So it's really a good teamwork. And then definitely there is the role of the medication. And medications, as we said, because the mechanism of it, there is a chemistry disturbance,
something going
with hormones. So it's really sometimes we need to do it. And if we need to do the medication part, so it's always parallel with the psychotherapy. We can't just give this magic pill and you are fine. It's not like this. And once we started with this treatment, we need the follow-up regular. We explain everything, and then we need patients regularly until we feel, okay, the patient is under control, stable, and then we can do the follow-up more sporadic during the year.
You mentioned something about sort of families.
Yeah.
And I think also depending on your upbringing, culture and stuff, whether you talk about mental health.
Yeah.
I don't know about Asian culture, South Asian culture, there's no thing as depression. Everyone's like, you're absolutely fine. You just got, just not get on with it. It's just part of your, so sometimes people don't talk about it.
Yeah.
So when you are going through it, you think, is it right? Is it normal? Is it not? Because, I didn't talk about this growing up. So, that's
this is the problem, because there is a taboo speaking about depression. And the problem, the hurtful part of this, people think when we are speaking about, depression or any mental health issues, like a sign of weakness.
Yeah.
Well, it is like a sign of strength, because once you solve the problem, it's done.
Exactly. Yeah.
So this is really sad. Culture, it's an important part. I know it's not so easy to speak about, and especially when we are speaking about, mental health for young adults. This is embarrassing. Not everyone is speaking about this. And therefore, we need to reach to everyone. We need to speak to them. Just make sure this is the same as any other illness, as diabetes or high blood pressure or other things. We are taking medications for them. Why don't we, and treating them, why don't we do the same thing for this?
And when you think of mental health and physical health, why is it when you think of physical health, it's not seen as a negative sort of thing, whereas as mental health, you think, like you said, that's a sign of weakness, something we shouldn't talk about.
So it's really sad, really sad. And imagine something we can handle it.
And imagine people who are going through it, and at that time you just feel like, oh no, it's okay, and I won't, like you said, there's certain steps you take and speaking to people, and imagine they can't speak to anyone and they just bottle it in.
Yeah.
That can have a serious effect, can't it?
Yeah. We have two balloons, and this is the one who has been struggling with depression, stress, anxiety, and all other pressures, around, and couldn't or wouldn't seek help.
Okay.
So it became like this, filled with all the negative things.
So from this to that.
To this.
Okay.
So imagine what happens if we didn't do anything. If this...
Well, I mean, I'm guessing it would be filling up more and more and more
until
it bursts.
Yeah.
And you can't, that's actually really sad if you think, about, you're bottling stuff up inside.
Yeah. So I think we need to pop it. So we don't have...
You know what? I have my trusted pin.
Yeah. So imagine, this is the thing. So no treatment, no management, not seeking help. This will lead to... Ouch. Yeah, this is the thing. But imagine the other way around. If we are struggling.
So for those who don't know, I do asthma sessions with Vin on Tuesday, right?
This is like a test.
Really testing my peak flow.
So it's peak flow.
Okay, so like, do I do a little bit at a time?
So yeah, so imagine this is like you feel depressed, you feel stress, and continue doing another one, and then stop here, and then you got, you thought about it, and you feel like you don't feel good, so you sought help for this, and you gave like advice to start, for example, physical activity. So it started with saying,
out, right? Can you guys hear that?
yeah,
Can you hear it on my mic?
yeah, more.
All right, so I'm letting go.
And then stopped here, and you still feel like the stress started, to build up, and you can like,
all that stress.
So imagine now you started to have like psychotherapy, speaking to a counselor, and you start doing physical activity. Imagine,
So
continue doing more,
boxing,
counseling, speaking to someone, and you sleep well. So it's better now. So it's like, the balance, because, ups and downs are always in life. We can't like live without these things. The good idea, the principle here is how to control it, how to cope with this. So it doesn't mean to be happy, I don't have stress. This is like unreal. So we need to think about rational, things. We have stress in life, we have problems, but the thing is, the good thing, how to control them, have to have this balance. So it's like this, we continue having stress, we like getting of it, like by physical activity, speaking to someone. And sometimes if you have like a trustable friend, at least to vent. Sometimes it's like mild, this would be enough. So we don't want you to explode like that. It's enough for you because you have asthma.
Do something funny.
Yeah.
I'm gonna let go of it.
Yeah. And and imagine you've done everything possible. One. Yeah.
I don't know.
But you're still, So the thing is that it's like this. We need to handle it. We need to deal with it. And I'm just thinking, it's always three things I always tell people to think about, especially young adults. This is the main thing. This is the main thing of all these things. You're not alone. All of us have problems you cannot imagine, and everyone around you might have problem. So be kind to yourself and to others. And just to this part, I don't know if we have few minutes. Do we have few minutes? Yeah, just to say something really. I've had an amazing friend and colleague who I loved really too much. And we were working in the same room for a long time. And he was really pure, like life lover, enthusiastic person. And in addition to this, he was a psychiatrist. So imagine, so we worked together for a long time, and we were really good friends. And after a while, so we worked in different places. So so sad we didn't have like this, I was busy, he was busy with our lives. So I haven't been in contact with this person, sadly, which I regret a lot. Anyway, so after a while, I've heard that he committed suicide.
Oh my goodness.
And this was real shock for me because...
You saying it as well. Like,
it was like, he was unbelievable. Every time I think about the whole thing, it's unbelievable, incredible. He was full of life. He was really amazing. He was giving hope and, helping everyone. And he was young. So, and he was successful. So everything was, if we measure it according to our measurements, it was like perfect.
wow.
But I think he was alone. He didn't have this good family supporter.
Sister,
So therefore, I always say, you're not alone, and be kind to people. You don't know what is hidden behind the, closed doors. So please seek help if you feel like you're not feeling good, and there's always help. This is the first thing. The other thing is that, professional help is important. So seek help from the right source. Speak to us because this is important, and we are supporting, and we are here for you, and you're not forced to do anything if you don't want to do it. And this is tough, and it's not everyone understands, but it's really life stuff.
Yeah.
So we need to take care about each other. And the last thing is like your responsibility, and you're resourceful, you're full of resources, and the power inside you can change the world, really. And if you feel that this is not for me, I'm feeling really bad or whatever, there are people feeling really, really bad and made it.
No, honestly, thanks for sharing, because I know I can see you,
Yes, like, it's really,
You even saying that, I think sometimes you have someone that, you can go to and you can share things, and, and then you've got people who kind of, take it in, and they listen to and they, they're that person that you can go to, but they don't often share things with you maybe. And, I remember in our, I've got a group chat with a few friends from and they will always, offload in that group. So they will say, oh, this is going on, that is going on. So they'll speak about it. And I feel like I'm probably the one who won't. So, and then they're like, oh, but when I do offload, then they're like, oh, so all this was going on and you didn't say anything. How do you keep it in? And it's back to that balloon where you keep it in, and then it suddenly, it could become too much. So definitely, you can.
And why is that, And
I don't know.
Why is that? Why don't we be just open?
I know. Now, after these sessions, that's all I'm going to be doing now.
Yeah, really. Because, and even, if you are in the street, in the train, wherever, you start to excuse people when you see something that you don't like, or they're behaving in some way, you understand there's something hidden. There's something. So at least you are not, behaving the same way or reacting the same way. So I think if we mix everything with love, with understanding, really, life will be much, much easier. So,
and one of the things you mentioned that came to mind as well is sometimes just to ask people. I think sometimes someone's waiting for you to just ask them, "Are you okay? Do you want to speak to me? Do you want to say something?" I think sometimes we feel, just take that first step and just speak to someone, because sometimes you can see those signs and symptoms that you were talking about, and you might feel like, oh, I don't know, should I ask, should I not? But just maybe that's what they're waiting for, just to offload, right?
Yeah,
just
I agree with you.
First step.
The funny thing is that sometimes when I don't feel well, psychologically, mentally, and then one of the patients asks me, how do you feel? I don't say, I'm fine.
Yeah.
Why are you lying?
Yeah.
I'm not feeling well. And the patient asks me, what's happening? I'm tired. Okay. So I think this is the way of communication. And when I'm asking someone, how are you? I'm really waiting for an answer. It's not, I'm caring about this person. So let's take care of each other. Please seek help. There is help. And life will be much, much easier if you have the tools. This is the thing.
Yes. Is there more, is it more common in certain, groups of people, or is it harder for, men to talk about specifically, about things that they might be going through? I think suicide rates are higher. Men, aren't they?
That's right. Yeah.
Why do you think?
And maybe because they are seeking help late. This is the problem. This is the issue. Therefore, I think a lot of factors, because the main concept, the man is the one who is responsible for the family, and the other things that we know is the taboo. It's they regard this as something like shame when you have mental health issues. So they try to hide it all the time. And it's not so easy for them to try speaking about, mental health issue. And, they think, as we said, this is a sign of weakness. And imagine how strong is the man who is coming for us, telling me, I'll tell any GP that I'm not feel good. Really, when I hear this, I feel, oh my God, what a person.
Yeah. It probably takes more strength and courage to actually open up about it. Right?
So definitely it's more common in men regarding the depression, and a lot of risk factors. Being a man, a male, is one of the risk factors, and other risk factors like job, the type of work or not working, employment, the family, all of things, the financial issues. So this is therefore we are a bit more concerned if it's a man who is seeking help. Yeah.
There are a lot of organizations and things like you mentioned, specifically for men. They do groups, they do sessions. Sometimes you might feel more comfortable to speak to people, you know, who are similar to you. So there is, like you keep saying again and again, there's help there. There's support groups. And it's so easy to access.
And it's important that they understand it's their decision. We are not forcing you, you know. I just want them, please understand, it's your responsibility and it's your decision. And we're here just to help you doing this. So yeah.
See you guys.
Thank you. Bye-bye. Bye.
Bye.